ACL injury, very common, especially if you are a young adult into sports, and also if you are in your 30s or 40s in any kind of activity, like you go for trekking or playing some sport, you may injure your ACL. ACL is anterior cruciate ligament. It is one of the ligaments that helps in supporting and stabilizing the knee joint. So there are two cruciate ligaments like you see in this model. This X-shaped ligaments are anterior cruciate and posterior cruciate ligament. Now, because the posterior cruciate ligament is at the back side and it is more stronger than anterior cruciate, so it is less prone for damage. But anterior cruciate ligament is very easily damaged. Now, how can you damage your cruciate ligament? While suddenly stopping from running, by suddenly changing your position, landing improperly on the ground while playing any kind of sport, or any direct injury to the knee joint can lead to ACL injury. Now, how will it present to you? Firstly, you will get a pop sound while you are at play or once you are into that injury. Secondly, you will see a swelling around the knee joint. You may get pain, or sometimes it may not be very painful also. And sometimes you may find that your knee joint is completely stuck and you're unable to move, and any joint movement is difficult, and instability can also be present. So what you're supposed to do at this point of time? Firstly, you need to stop whatever you are doing. Second thing is you need to lie down, put a lot of ice around your knee joint, do a bandage of the knee joint because the swelling should come down, elevate your leg and keep it. If there is pain, you can take over-the-counter drugs like any kind of NSAIDs, and you need to visit the doctor, get an X-ray done to rule out if there is any fracture, and if required, if your doctor says that MRI is necessary to find out what is the injury, get a MRI done. Now, if your MRI says that there is a ACL injury, they will also mention whether it is grade 1, grade 2 or grade 3. So, in grade 1 injury, there is minimal stretching of the ligament with no instability. In grade 2, there will be a little stretching and also some fibers will be torn. Instability may not be present, and that is called as grade 2. In grade 3, you will have a torn or a completely torn ACL. Sometimes it is not only the ACL that will be torn, but also the bone where it attaches will be withdrawn from the other part of the bone. Now, what you are supposed to do? Does all ACL injury need surgery? That is a very thoughtful question, because ACL injury, whenever seen in MRI, most of the patients get really panicked, and once the doctor says that you need to go for surgery, they are completely confused. Now, do you need surgery or not is very important. You need to go for surgery only if you have instability after 2 to 3 weeks of your injury. If you don't have instability, surgery is a big no. Now, what we can do for that? First thing is you need to take care that your pain has come down, that we can manage with any kind of NSAIDs. Your effusion or your knee swelling should come down. So you need to make sure that you don't do weight bearing, but you need to be active. Then we can do certain exercises, which are very simple exercises to keep your joint movement, not the heavy ones. And we need to give some time for your ACL, for the inner soft tissue inflammation to come down. After your inflammation has come down by 1 to 2 weeks or maximum 3 weeks, now at this point of time, there are so many other injection treatment like a cell proliferative treatment, where we can boost in and fasten the strengthening of ACL very easily. These are small injection techniques which can be done by a pain physician under ultrasound guidance, so that you fasten up the ACL injury and weight bearing becomes even more faster. So if you have any kind of ACL injury, do not opt for surgery until and unless you have continued instability, because once you undergo any kind of surgery, then you are prone for early cartilage loss, meniscus injury and early onset of arthritis. So make sure this injury does not lead to other problems in future. So opt for cell proliferative therapy and good rehab, followed by certain weight reduction, lifestyle modification for early recovery from your ACL injury.